Really enjoyed spending the day here with you all, getting our MCLE credits. But I know I'm the only thing between you and dinner with your family, so I understand, get that. But I'm very excited to be here tonight to talk to you about a topic that I care very much about, and that is the Affordable Care Act and its implications for addressing health disparities, specifically among the Latino population in California. As was stated, I represent 900 community clinics and health centers in the state of California that provide comprehensive, high-quality care to individuals primarily in low-income communities. The clinics of California actually serve nearly 5 million patients, and of those patients, 1.5 million are Medi-Cal patients served under the Public Insurance Medicaid program, and 1.6 million are uninsured and have no form of insurance currently. Our membership is comprised of a diverse range of community clinics, but what they share in common is that they are all licensed nonprofit entities governed by community boards of directors, and in fact there's a legal requirement on the largest segment of these community health centers that they have a board of directors that is comprised of 51% consumers of the clinics. So they are unique in the country, community health centers, in that their governance is actually from members of the community. The unique services that community health centers provide, and they are unique in that they are very comprehensive in their nature, with the focus on prevention and wellness and ultimately improved health outcomes. They provide a medical home, which provides a multifaceted approach to healthcare, which really takes care of the patient's needs and ultimately the family needs. Community health centers go well beyond basic primary care and provide, for example, dental and mental health services, often under the same roof, and even specialists are brought in-house to provide care to the patient. So it's really a unique model that you can get all that under one roof. And that is why in healthcare reform, community health centers were actually embraced by the Affordable Care Act with an $11 billion investment nationally in this model of care, because the Obama administration and Congress recognize that it is a very effective model that should be expanded. Now, why the Affordable Care Act has been so important to me personally is it's pretty much what I've spent my whole career on, is the issue of advocacy for healthcare reform. I started out at law school about 20 years ago when President Clinton was introducing healthcare reform, and I went to the Law Office of Public Advocates to be an advocate in the Latino community, unsure of which issue it would be, and I think it was very fortunate that it ended up being healthcare, because at the time, 20 years ago, when Clinton was talking about healthcare reform, there really was no Latino voice in the policy arena in the state of California to address the healthcare issue. And that is why I had the privilege of founding the organization called the Latino Coalition for a Healthy California, which came into place in order to provide that Latino presence in the healthcare reform debate. And it continues to this day to be the only Latino statewide advocacy organization with a specific emphasis on issues of Latino health and that kind of advocacy. But now I have been at the California Primary Care Association for about the last 15 years, working with the community health centers whose role has been, in the absence of healthcare reform, to be that key provider of care, or the safety net, if you will, for millions of Californians who are really struggle with access to the standard system of care that other people have access to, the private physician system, for example. So the community health centers have been there, waiting in the wings, but certainly serving millions of people in the state of California with this kind of comprehensive set of services that I mentioned. And it's really taken us 20 years to see this healthcare reform become a reality, which to me has been very affirming of the motto, never say never, because really it just seems like there's been so many fits and starts to make this happen, but it is the most significant legislation in the healthcare arena since the passage of Medicare and Medicaid. And certainly for addressing the issues of health disparities and for Latinos, it is extremely significant. And that's what I want to talk to you about today. This issue of healthcare reform becoming a reality has certainly been reinforced with the re-election of the Obama administration, which was due in part to a Latino voter turnout and was in part seen as a mandate for healthcare reform. Now, according to exit polling, roughly 50% of Latino voters showed up in the polls on November 6th, and they were 10% of the total voter turnout, with President Obama garnering 71% of the Latino vote nationwide. Now, certainly the economy was actually identified as the most significant issue for Latino voters, and no surprise given how we're all impacted by this economy. But healthcare was noted as the second highest rated issue of concern to the Latino population. And this certainly makes sense due to the fact that, particularly in California, Latinos really stand the most to gain from the passage of the Affordable Care Act. You're probably aware that in the United States, certainly in California, Latinos are the largest and fastest growing minority group. There's over 50 million people of Latino origin in our country, making up 16% of the population. While in California, there's 14 million Latinos, which is 38% of our state's population. But despite these numbers, there continue to be very significant disparities in accessing healthcare and healthcare insurance due to a number of barriers. Latinos are more likely than any other ethnic group to not have health insurance. 32% of Latino adults are uninsured nationally. Basically, one in three Latinos does not have insurance, and this is despite high numbers in the workforce. But there's very many reasons why. Socioeconomic barriers, they're more likely to live in poverty, have lower educational attainment, and higher levels of unemployment, but there's also cost, with 60% of Latinos stating that cost is one of the primary reasons they don't have health insurance, followed by the fact that their employers do not offer it. And many low-income Latinos are in job sectors that are less likely to provide health insurance, such as agriculture, manufacturing, construction, and service sectors, low-paying industries that don't provide health insurance. So Latinos are largely the working poor, and that is largely why they don't have health insurance. Immigration status is also a factor for the Latino population. Certainly undocumented individuals are completely barred from accessing federal programs such as Medicaid. It's estimated in our country there's 12 million undocumented immigrants, with 3 million residing in California. So they don't have access to the public programs other than emergency care and prenatal care principally. But also just lacking health coverage at a disproportionate rate and a lack of knowledge of the services available. Certainly language and cultural barriers can be a challenge to getting health care, and they also report a lack of comfort with the healthcare facilities that are available to them. Another just a fact about the disparities in terms of Latino physicians in our state, with Latinos being 38% of the population, Latino doctors are 5% of the physician population. So just having access to a physician from your culture or that speaks your language is very challenging for this population. We also know that people who are uninsured are less likely to seek preventive care, so their conditions can go on untreated until they become much more serious. And the Latino population actually has higher rates of heart disease, cancer, and diabetes, and they can often end up, dying or in very serious and critical condition because of a lack of care. And we can't forget about California's migrant population. We have the highest migrant population of any state in the country, and the vast majority of migrant workers are Mexican immigrant families. Again, tend to work under low wages, don't have health insurance benefits, workers' compensation, or disability coverage, yet they are working in dangerous conditions and are one of the United States' most vulnerable population. So this is a major segment of the population that is served by the community health centers that I represent. In fact, out of the 5 million patients that we see, over 2.5 million of them are Latino, because community health centers will see anyone who comes through their doors. That's regardless of their immigration status, their insurance status, their ability to pay, the language that they speak. We are open door providers. So we have community health centers that serve the migrant farm worker population. Many of them are located in urban and rural areas throughout the state, and Latinos are major users of the community health center system. Now, while the Affordable Care Act will not provide coverage for everyone, it is going to go a long way to close the gap for the Latino population in California and nationally. The ACA aims to make coverage available to more than 30 million uninsured Americans. There's a lot of people out there without health insurance. Did you know in California alone there's 7 million people who don't have health insurance? 7 million people walking around out there scared to death of whether they're going to get sick. And knowing that if they do, they're going to end up in the emergency room and ultimately probably have to pay out of pocket. It's not only undocumented people who live in fear that they don't have access to a physician. 7 million Californians. So this Affordable Care Act is going to go a long way to close that gap. We're very fortunate that in June, the Supreme Court upheld the constitutionality of the ACA in a historic decision that's going to have an impact on the federal and state funding of these programs from here going forward. So there's two key provisions of the Affordable Care Act that were at stake in the Supreme Court decision. And one was the Medicaid expansion, which is the expansion of the current low-income public program, principally available currently to pregnant women and children. And the idea under the Affordable Care Act is to expand that to make it available to all low-income individuals. And then, of course, the individual mandate, which requires everybody to have insurance or to pay a penalty. And what ultimately the Supreme Court did, as we heard this morning, was allow the individual mandate to go forward, but ultimately, in terms of the Medicaid expansion, what it will not do is allow the federal government to mandate that the states expand Medicaid under a threat of losing funding. So the states actually have the option to expand Medicaid. But because of this Supreme Court decision, the key provisions of the Affordable Care Act, the Medicaid expansion and the individual mandate, can go forward. And the hope is that many states will take advantage of this. Certainly, California is on track to fully take advantage of the Affordable Care Act. One of the key provisions for implementing the mandate is the creation of health benefits exchanges. The exchange is a mechanism to create an online shopping mall, if you will, for people to buy their insurance. So California was the first state in the country to establish in legislation an exchange. And there has been an exchange board that has been working for well over at least the last year, putting all the provisions in place to be able to launch this exchange for 2014 so that people can purchase their insurance under the mandate. Again, California totally ahead of the curve as the first to establish and begin to implement that exchange. And then certainly the Medicaid expansion. While I will have to admit we went through some scary times with this past election with the governor's Proposition 30 on the ballot. You know, certainly the state's budget crisis is a factor in terms of what the state can do for public programs. And even though the Affordable Care Act will pay for the Medicaid expansion at 100% of the cost. Right now, Medicaid is 50%, 50-50 state funded, 50% federal funded. The Affordable Care Act for the first several years will fund the Medicaid expansion population at 100%. But because of the state budget deficit crisis, there was some concern about whether Governor Brown was kind of waffling on the idea of California taking on the expansion. And in fact, before the election, he didn't sign some very crucial Medicaid expansion implementing legislation that we thought he would be signing, saying that he was going to put that off until a special session after the election. Well, with the passage of Proposition 30, and which has helped the fiscal outlook of the state significantly, there is much less concern about whether or not California intends to move forward, and the expectation is that we will be moving forward with the Medicaid expansion, which means that the key provisions of the Affordable Care Act will be implemented in the state of California. which again will be very significant. For example, through the Medicaid expansion combined with the exchange, which will be subsidized insurance for the lower income people of the exchange, it is expected that 3.6 million out of the 7 million uninsured Californians will have health coverage. So this is the way the Affordable Care Act is going to make a significant dent in uninsured in our state. And it's really going to have a huge impact on Latinos. This Medi-Cal expansion alone, which again targets will go for the lowest income individuals having this public program, it's going to provide coverage to over 1 million Latinos in the state of California. And another 1 million Latinos are expected to purchase their coverage through the exchange. Now, when I say that Latinos are going to benefit, I mean, this statistic says it all. It is expected that of all the newly insured people, that means people who currently don't have insurance, who as a result of the Affordable Care Act, either through the Medicaid expansion or the exchange, will have insurance, it is estimated that 60% of the newly insured in our state will be Latino. And I think that says it right there about how we will ultimately benefit from the passage of this act. Now, another way that the Affordable Care Act will address the disparity and challenges in our Latino community in terms of access to services, because it's one thing to have an insurance card, it's another thing to have access. And you're probably aware just from general media that the Medicaid program, there are challenges with getting physicians to accept Medi-Cal patients. Again, it's a lower income population. It hasn't been seen as necessarily an attractive population to some of the general physician community out there. Not across the board, but it is a challenge to have physicians involved in the Medicaid program. But the community health centers, I mean, Medicaid is the backbone of their funding. That's the main public source of income for community health centers. The Medicaid population is their target population. And again, that's why the Affordable Care Act invested this $11 billion in the infrastructure of community health centers. Already, $200 million has come to the state of California and come into these community health centers. These dollars have been used to create, so far, 45 new health centers in communities that previously did not have this level of service. So there's 45 new clinics that have cropped up in different parts of the state, many in Latino communities, because those are the underserved communities of our state. A portion of the dollars was used for capital renovations and improvements and expansions so that existing facilities could, grow larger, look better, whatever the health centers needed to do to improve their services ultimately. So this expansion is really expected to continue to flow dollars into community health centers. Ultimately, the $11 billion commitment may not fully come to fruition because of debates and challenges at the federal level. So I'll just give you an example. Last year, the first $1 billion that was supposed to flow to the health centers ended up being cut by $600 million through the budget process at the federal level. And so ultimately, it may not be an $11 billion investment, but it still is going to be very significant and will expand access to care throughout our state. So while the Affordable Care Act has surpassed the large hurdles of the Supreme Court in the recent election, there continues to be concern with the debate in Congress right now. The fiscal cliff that we keep reading about in the newspapers could also have an impact on how the Affordable Care Act is implemented. What's been talked about is just concerns about whether instead of a full 100% federal share of the Medicaid expansion, if that could be cut back to be less. Well, anything less than 100% is not going to be well received in any state, including a state like California, because the states have been ready for this expansion to take place without them having to pay a share of that. And certainly the fiscal crisis that's happening at the federal level is happening at the state levels as well. So if the dedication to the Medicaid expansion isn't at 100%, that could have a big impact on the ACA implementation. There's also been talk about whether there could be a reduction in the commitment to subsidies in the exchange. Because remember, people going into the exchange, you're going to have to pay for care. There's a mandate. It's not going to be free. You have to buy care in the exchange. But there are federal subsidies to help offset that cost. But there has been talk with the fiscal cliff and all the consideration what's happening in Congress of whether or not they would cut back on the financial commitment to the subsidies. These are just two examples. Certainly the community health center funding could also be at stake again. So we're not out of the woods yet, ultimately, when it comes to implementing the Affordable Care Act. There could be pieces of it that we're really challenged with. But one of the challenges we're going to face in California as well goes to the whole issue about how we're going to educate people about the fact that this mandate is here, this opportunity is here, the Medi-Cal expansion is happening. And the Health Benefits Exchange just came up with their name. You're going to probably be hearing this. Covered California. That's what they're going to be called. Covered California. Unfortunately, they ruled out avocado, which was one of the other big contenders, but it ended up being Covered California. And again, this will be that online shopping portal for consumers to find the coverage that they think is best for them and to ultimately sign up, and through this, what they call no wrong door approach. So whether you're a Medicaid individual, whether you're an exchange person, you should be able to go through this insurance portal, actually qualify online, and be able to ultimately pick a plan. And let me tell you, if and when this works, that'll be incredible for the state of California, given the very bureaucratic and challenging process we have currently for signing up for Medi-Cal or any state public program. To have a no wrong door, one entry computerized portal, it almost sounds too good to be true, but that is what they are on track to do in the state of California. But it's going to be critical that they create awareness of these programs for the people who are going to be eligible. Covered California actually has $40 million from the federal government that they are going to be making available in grants to community organizations such as community clinics and nonprofits and other entities out there to facilitate and educate. There's going to be $58 per person that these entities will be eligible for as a fee for successfully enrolling people into the portal, into these programs. So it's great that there's going to be dollars available for this, because certainly this piece is going to be really critical. Another issue we're concerned about are the workforce demands. That all these millions of people who before didn't have insurance, or anything, they were avoiding the healthcare system, now they're going to have access to insurance. We already have a workforce crisis in the state of California. We already don't have enough primary care physicians to meet the demand. And now all of a sudden we're going to bring millions more people into the system. Believe me, this has been a very significant concern. And one of the things the Affordable Care Act does is invest in the National Health Service Corps program, which is a loan repayment program for graduates of medical school who go to work in underserved communities. That's going to place 15,000 providers in provider shortage areas throughout the country. There's also scholarships for medical, dental school, mental health providers. There's other components of the Affordable Care Act to address workforce, but the challenge we have in our state is pretty daunting, and I think we can expect that there could be access challenges for people in 2014 when all this insurance comes into place. So while the Affordable Care Act is going to go a long way in addressing health disparities among our Latino population, there are certainly areas for improvement. And one of them is, unfortunately, the fact that the Affordable Care Act does not include any coverage for undocumented immigrants. They were excluded from any source of coverage under the Affordable Care Act. And from an income level, about 73% of the undocumented in our state would qualify for Medi-Cal, but none of them are going to be eligible. They're not going to be able to purchase insurance through the exchange. They'll be completely barred from that. And that's really going to be leaving millions of people continuing to be without coverage in our state. The exclusion was seen as politically necessary for the passage of reform, but the reality is that we're really never going to have true health care reform until we have comprehensive immigration reform in the United States. Immigrants who are legal residents are actually also barred from Medi-Cal until they've resided in our country for 5 years. So the newly arrived immigrants will continue to also not have be eligible for the Medi-Cal program. And you might have heard recently about the Deferred Action Childhood Arrivals, the DACA individuals that President Obama carved this special population out and allows them to apply for deferred action for deportation. So this is a group that can now temporarily remain in the United States and obtain work permits without fear of deportation. But we were very disappointed that recently a final rule came out from the Department of Health and Human Services, which actually affects their eligibility for healthcare programs for these DACA individuals, and it actually excludes them from any eligibility for insurance coverage in the ACA. So they're treated just like the current undocumented immigrants. No Medicaid, no eligibility in the exchange. So certainly the ACA goes a long way to addressing the disparities in the Latino community, but there certainly is a major segment of the population that continues to be left out. And a recent study by UCLA and UC Berkeley found that of the people who will remain uninsured after healthcare reform, 25% of them are expected to be undocumented immigrants. And this is several million people. Well, who are the rest going to be? Who are the other people who are going to remain uninsured if only 25% are undocumented? Well, interestingly enough, it's going to be all the people who are eligible but don't enroll. So either because they didn't know, they said they can't afford it, and 70% of them are going to be Latino. So again, we're back to who's going to be left out ultimately again, and that is why the whole issue of outreach and educating people about the availabilities of these programs is so important. And finally, what we expect to see is that until we have the coverage ultimately really for everyone, the community clinics and health centers will continue to be the safety net, but our role is evolving. We don't expect to only be the safety net now that the ACA is passed. We fully intend and expect to be the provider of choice for millions of Californians, those newly eligible. And we think we have reason to believe that they will want to come to our health centers because of the comprehensive quality services we provide, the easy accessibility in the community, the positive reputation, which has been demonstrated through a lot of research about how current patients feel about the care they get at health centers. And community health centers will stick with their mission to see everybody who comes through their doors, regardless of their status. We're going to continue to be a source for millions of low-income Californians, but we will also, we hope, be a source of care for millions more who ultimately have insurance under the Affordable Care Act. So for all of you that may or may not be impacted by this incredible law, just know that there are millions of people in our state who are ultimately going to benefit and can come out of the shadows and not have fear every time they catch a cold or their baby's sick, because they will ultimately have access to insurance. Thank you for having me here today.